We've had an increased use of opioids in the community, misuse of it, and even today, just half an hour ago, we had a patient 2 beds from here who required naloxone. They got some from the EMS and came in and required more, and that's going to be a candidate that's going to get the kit after their acute stay here. So if the person's taken a lot of opioids, the effect on the body is that they would be unconscious, unable to breathe. The naloxone kit reverses the effects of the opioids on the person's body. There were some overdose patients that we talked to who wanted the kit. They asked for it by name to us, and we weren't able to provide it. We were able to tell them they could go to their pharmacy, they can go to public health, but there were some restrictions around that. Those places are not open all the time. The best time to actually give them something is right when it happens, before they leave. And I thought, well, let's put it on the CQI board, give it some push to have it happen. We mentioned it at one of our morning huddles, and luckily at that time there was also the director of our program and also the president of the hospital on hand, and that got them thinking, well, yeah, this kind of seems like a thing that the general, knowing that our population and the community that we're in, we should have a solution for this. Trying to come up with this solution without putting it on the CQI board, I really didn't go very far in about 6 months, but once it was on the board, I think the timelines went to within a month. It was at this site, we developed the education, and then within 3 months it was at every emerge at HHS.